Hello, everybody, and welcome to another Ask WHO coming to you from WHO headquarters here in Geneva and elsewhere. My name is Nika Alexander. I'm part of the communications team here at WHO. Today's Ask WHO is on cases of hepatitis or liver inflammation in children. Something people have been following for a few weeks now. We have with us two experts to answer your questions. We have Dr. Philippa Easterbrook. She's a senior scientist in the department that manages hepatitis here at WHO headquarters. And we have Dr. Richard Pevity. He's team lead with WHO's, the team that works on emergencies in Europe, in WHO's European region. Welcome both. So to ask your questions, use hashtag AskWHO, as you would have if you've joined us before. Use hashtag AskWHO on Twitter, or drop your questions into the comment section on Facebook, LinkedIn, and YouTube. So just very off the top, while we're waiting for your questions to come in, I'll start with a question to you, Dr. Easterbrook, Philippa. What is hepatitis and what normally causes hepatitis?
Thank you, Nika. So hepatitis is the medical term for inflammation of the liver. And that inflammation is defined really by elevation in the liver enzymes. And so the most common causes of hepatitis are viruses, and the most usual ones are hepatitis virus A, B, C, and E. It can also be caused by other viruses, and they include names like cytomegalovirus and herpes viruses and a parvovirus, but can also be caused by medications, toxins, so non-infectious causes as the most frequent causes, but there are other rarer causes also. It's not uncommon in children, but severe hepatitis is unusual.
Thanks, Dr. Easterbrook. And you were speaking specifically overall on what causes inflammation in the liver normally, and not about these particular cases that we're following now. So what's unusual in what we're seeing, or what's the signal that we've been following? And I'll go to you, Dr. Pevity, for that one. Basically, why are we having this session? What's the alert that we've been following for the past few weeks?
Thanks very much. Yeah, no, so the alert has come because we've seen something a little unexpected, and the alert came originally through from the United Kingdom, where they picked up reports from clinicians, astute clinicians, of more cases than expected of severe hepatitis amongst young children, so children under 10 years of age. And this is a group in whom this type of clinical presentation is pretty unusual, and that clinicians were seeing more cases than they would normally expect to see. Now, of course, very quickly they were investigating what the usual causes of hepatitis might be, the ones that Philippa was explaining a minute ago, and these children were all negative for hepatitis A to E, and so they clearly thought something unusual was going on, and that then led to notifications through to the public health authorities, and then the United Kingdom has then started to look more widely to see if there were cases occurring elsewhere around the countries of the United Kingdom, and indeed that they have found additional cases, and that then led to an alert coming through to WHO, and so what we've obviously been doing is alerting other countries to say we think there's something unusual going on in the United Kingdom, what's going on in your country. And so really we've now been trying to piece this story together, and now with countries reporting around 170 cases fitting this type of picture, coming from 16 countries across 3 different regions. So, you know, the numbers are mounting up. Most of the cases at the moment are still coming from the United Kingdom. But there's work, clearly, that a lot of work going on now to try to understand what the cause of these presentations might be. We're working with the countries to really understand that, and obviously refine our recommendations and so on to parents, to public health authorities and others.
And Nika, if I may just add 2 other points.
Actually, not yet. Oh, we didn't cut her off on purpose, but not yet, because I want to start taking questions already. They might lead you to add 2 other points. So Lisa Francis and Veronica Douglas have both asked, so do we know what the cause is yet? And they both asked whether or not there's any kind of link to COVID. So I might go to you first, Philippa, on what we know about the cause, and then I'll go to you, Richard, on anything related to COVID. So just starting with you, Dr. Easterbrook.
Thank you. So I think just to preface my remarks by saying what is particularly unusual is that the majority of these children were previously healthy, because we sometimes see hepatitis in patients who their immune system has been compromised, and also that this was associated in a proportion of the cases with liver failure and needed transplantation in some of those cases. So that is what in part sets it apart from other outbreaks of hepatitis, and that none of the usual causes were explaining these cases. So moving to the point about what we now think from the initial phases of investigating these cases, and this is actively going on. And so the main areas that one looks at in a situation like this are infectious causes due to viruses or to the bugs, the bacteria, and non-infectious causes. And that can be related to a food, a toxin, a medication. And so these have been the main lines of inquiry. And so far, the information suggests that none of the common viruses, that's the hepatitis A, B, C, or E, explain this picture, that none of the other viruses that can cause hepatitis in children, like parvovirus, for example, like CMV, like the glandular fever, Epstein-Barr virus, seem to account for this. And as far as we know, none of the kind of more common bacteria that can cause food poisoning, like Salmonella, account for this. And then through the detailed questionnaires that have been administered in many of the cases to the parents to complete, there doesn't seem to be a common exposure to a drug, to an environmental agent, to a toxin, to a particular type of food or travel that's accounting for this. And then finally, one of the other lines of inquiry was about vaccination. And certainly the majority of children, as part of this investigation, did not receive the COVID vaccines. So at present, there does not seem to be a link. And one of the early inquiries in terms of other infections that might cause this was a signal in at least some of the cases of adenovirus, a very common, usually respiratory, but sometimes infection that can cause gastroenteritis and stomach upsets, that was seen in some, but not all of the cases that have been tested. And this was also in association with seeing an increase of the transmission and detection of this virus as part of routine surveillance and getting results from lab tests, from cases that were coming into hospitals, that was above what had been seen in the last 2 years. This doesn't, at this stage, prove that there's a causal link to these cases, but it is a promising, interesting early signal that is being looked at in more detail.
So you've answered a question from Cassie Kolaski, actually, who was asking if it's viral or environmental. She mentions that it's not contagious, but we don't know that yet. It's something we're still looking at. Dr. Pebity, can you help us understand how WHO supports in a situation like this? So UK health officials are following up, but what does WHO do in a situation like this?
So WHO's role is actually very important in terms of alerting other countries. So obviously the UK is very well set up to understand what's going on within the UK setting, but we've been working very closely with the UK authorities and also colleagues at the European Centre for Disease Control to help then share the information with other countries to help alert them that there may be an issue going on in their own settings, to encourage them to look for these types of cases, and if they find them, to obviously investigate and report them. So, and that's indeed what's been happening, and so the emerging picture is obviously the one that we've now been describing now, with the 170 odd cases across a number of countries, and yeah, we as we heard, the picture is unclear as to what the underlying cause might be. We do know that a proportion of hepatitis often does remain unidentified, but in this instance, we do seem to be seeing more than expected in not only in the UK but in one or two other countries as well. And so one of the leading threads of investigation is the adenovirus possible association, which countries are actively exploring. So from WHO end, we're again supporting those investigations to try and get to the bottom of this.
So basically, as I've seen in other outbreaks that WHO's worked on as well, so we consolidate and share the information, because the UK might not have a platform in which it can share information with the rest of the world, but WHO has a system through the international health regulations where we can send out alerts to focal points in every country around the world, letting them know what we've seen, letting them know what they should look out for as well, and then sharing that information back as well with other colleagues. I have a question with other countries. I have a question from Masoud Joketsai, I'm sorry if I've mispronounced your name, asking, why is it so difficult to find the causal agent if countries that have good lab systems and good disease surveillance systems aren't able to find the cause? So it's almost philosophical, I suppose. You know, how unusual is it for there to be a signal like this of something for which we don't know the cause? So maybe start with you, Dr. Easterbrook, in your experience, have you seen this before? And, you know, how unusual is it for there to be this kind of a medical mystery?
Thank you. Well, I think the first point is that these unexplained cases of hepatitis have always existed, but at a very low level, where the standard tests have been done and there's no clear cause. And these happen at very low level in most countries. But many of those countries don't necessarily have routine monitoring or surveillance for this. And that's why one of the first steps in this investigation is, are we seeing a signal that is definitely above what we would expect with these background cases of acute hepatitis? And I think it's been, I guess, beneficial and helpful that the first and most of the cases to date have been in the United Kingdom, which does have a very comprehensive surveillance system. So it has been possible through the routine monitoring of all lab reports with different viruses in different age groups, where you're able to look at what the background rate from respiratory samples or from fecal samples, what's being detected. And so that's been very helpful to be able to look at that the background rate before COVID was elevated a little bit and then went right down and is now come up again. And we've seen this for many gastrointestinal respiratory viruses, and adeno was one of them. So that was very helpful, having that good, robust system. And similarly, it's been helpful because there's ongoing reporting of acute admissions for liver disease, acute hepatitis, what are the presentations to emergency rooms. So there's quite a few sources of information which pulled together can give a picture of whether what's been seen is definitely out of the order. So it's a good foundation in those large numbers of cases for the UK to have got this detailed workup on the laboratory investigations and a background signal. Now, not all countries have that, and that is the support and the guidance that I think we at WHO are able to do for countries that don't have those very detailed surveillance systems. And that is the next step now, is really for those countries that are reporting new cases or previous cases to provide the data collection tools and the additional support so they can provide more detailed information.
I'm going to cluster a few questions here. So we have Abraham Forde Faijue, who's watching from Liberia, who's asking, how can you prevent hepatitis? He's asking in hepatitis, but I imagine he's wondering about this particular situation. We also have Janet Vargas, who's asking what parents can do to protect, what people can do to protect their kids. So in this situation where we're still not sure what the causal agent is, Dr. Pebede, what's WHO's advice to parents?
Yeah, no, thank you very much. So, I mean, at this stage, our key message really to parents is firstly not to panic. So, I mean, as we heard, this is unusual, but also we want to reassure parents, but also to be alert as well, and that if they notice, for example, their child developing symptoms of jaundice in particular, so yellow eyes and skin, dark urine, then clearly you need to contact a healthcare professional. In terms of prevention measures, these are very much the sort of the general ones of good hygiene, hand washing, good respiratory hygiene. Those will help to prevent the spread of common viruses and infections like adenovirus and other similar common viruses. So those measures will just help to reduce risk of spread.
Thank you. Similarly, a few people, Handor Hani and Donnie Gardner, are asking what the symptoms are that these particular children had. So, Dr. Pebede, you've outlined what to look out for, but what have we seen in common in the children that are part of the reported cases, I guess?
So, yeah, I mean, the children have very much presented with the classical symptoms of hepatitis. So, as I mentioned, sort of those symptoms of jaundice, those are very typical. But often as well, they've also got some associated enteric symptoms, so some diarrhea, and also some systemic symptoms of just generally being under the weather and feeling nauseous and sick and losing your appetite. Those are all sort of classical symptoms really of acute hepatitis. And of course, then when investigated, as we heard, when you have this type of acute hepatitis, then your liver enzymes are highly elevated. So those are the sorts of symptoms and signs that we would anticipate to see with these cases.
It's a bit difficult or complicated, isn't it? Because I know we were chatting the other day, Dr. Easterbrook, and children often get stomach aches, children often get diarrhea. There's millions of children right now with those symptoms. So, but I think it's important to remember what you had highlighted, Dr. Pebede, which symptoms are extreme or unusual that you would therefore want to speak to, want to consult the child's doctor. So there's sort of normal sickness, and then there's sickness that you should be extra concerned about. And because I think people really want to have that, would you mind repeating? Would you mind going over those, Dr. Easterbrook? So we'll have heard from both of you. What are the symptoms that parents really need to be looking out for that shows that something unusual is happening and your child is not having normal childhood sickness, but is particularly sick and you should seek medical help?
Yes. So I think, first of all, this event, I know we're seeing increasing number of cases, but it is extremely in the bigger context, a rare event. Stomach upsets, vomiting, diarrhea happen commonly in young children for a range of reasons and other bugs. But I think what is different here is that small subgroup that then go on to develop the jaundice with the elevated inflamed liver and the liver enzymes. And that is what is unique as compared with many other viruses that can cause a gastroenteritis, for example. And so I think for parents, and again, the message is to parents to help them understand when to become concerned. I think if there were certainly prolonged symptoms with the gastroenteritis and the vomiting, as with any child, regardless of concerns about this particular hepatitis, it would be good to then seek advice. And I think then the development of the jaundice with the yellowing of the eyes or yellowing of the skin, and then with very pale stools, those are the main signature features. Again, very importantly, then to seek medical advice. And in the meantime, as you would with any child who's vomiting or diarrhea, where there are concerns, the good hydration, and then taking precautions with hand washing and good general hygiene as a general good principle.
Good practice at the moment. While we're still trying to understand what the cause is, and Dr. Pebedy was saying that as well. It maybe will help your child not to get some other kind of stomach upset, and will help you from being worried at the moment. A few people are asking this, including Praxideus Cheruto from Kenya. Children who are already vaccinated against hepatitis, are they safe? But let me take a stab at the answer. Those children would have been vaccinated against the common known causes of hepatitis. And this is a situation in which we don't know the causes. Is that basically the answer?
Well, if I can answer that one, well, of course, the common hepatitis viruses that cause hepatitis are hepatitis A, which is mainly a foodborne or waterborne type of infection. And usually it doesn't cause major problems in young children. It's often when you get it older that you tend to have a more significant disease. Hepatitis B is a completely different route of transmission, and worldwide it's most commonly from mother to child transmission. And our way of preventing against that, and we've been very successfully globally in really reducing that as a form of transmission by vaccinating all children at birth. So we see much less of hepatitis B in high-income countries, but still a challenge in sub-Saharan Africa. Hepatitis C, we rarely see in children, and usually that is from mother to child transmission. There's relatively little. And finally, hepatitis E, for which there is also now a vaccine, is mainly in outbreak settings, refugee camps, where there's problems with the contaminated water supply in particular. So they all have very, even though they may all end up with hepatitis, they have very different routes of transmission and different ways of preventing.
So to summarize a bit then, the vaccine, when people say your child is getting immunized against hepatitis, they mean hepatitis B, is that right? And
that is correct.
Okay. And hepatitis is a blanket term for inflammation of the liver. So these children that we're following in this case have had basically their liver has been unwell, and it's not caused by hepatitis B. So they have been immunized against hepatitis B, but this isn't caused by that. I'm going into a bit of detail because we had a question from Rabua Christine, who's joining us from Fiji, and she was saying, why is the hepatitis vaccine not working? It may well be working against hepatitis B, but this is not what's causing these cases in particular. Can you give us the latest numbers, Dr. Pebedy? What are the latest figures that we have? I know there's media reports of further cases and so on, but what are the ones that we know of from official sources at this time?
Yes, at this point in time, we have around 170 cases across 16 different countries. So mainly countries in Europe, but there's also been some cases in a couple of other regions as well. So it's spread across quite a number of places. As I mentioned before, the majority of the cases are still from the UK, but there are other countries reporting numbers as well. So, for example, Spain, Israel, the United States have also reported a few cases as well.
So WHO has asked and invited countries to start looking and reporting cases if they see these unusual cases as well. A couple of people have asked, and most recently Mirna Gomez is asking, what are the risks for adults? Have we seen any signs of increased hepatitis or liver inflammation in adults? Maybe first with you, Richard.
So the short answer is no. So the original signal that came through was actually in younger children, so children under 10 years of age. So that seems to be where there are being more cases observed than we would normally expect to see of this particular unexplained syndrome. So that there haven't been similar reports coming through from older age groups, but clearly as we start to try and understand better what's going on here, there may be further cases detected in older age groups. But at this point in time, this phenomena has really been sort of seen in younger kids.
For now. Okay, thank you. I'm going to share a point with you that came to us from Lindsay Dean, who says, you mentioned you want to reassure parents, but if there's no understanding of why this is happening, how can this be possible? i.e., how can parents feel reassured? In the UK, with 2 young children, so hope you can appreciate we are worried parents. Absolutely, Lindsay. We do understand that it is worrisome, and that's why we're having this Q&A session. That's why public health authorities are keeping you informed. I think we were trying to say that the cases are still rare. If you look at the size of the population and how many children you are, there's very few cases, but on a population level, but you wouldn't want to be the parents of one of those kids who's needed a transplant or who's very ill, who's in hospital. At least one child has died. So absolutely, it's very worrisome. And we encourage you to continue to get information from reliable sources so that you can understand what the risks are and do what you can to protect your kids. So thank you. Thank you for keeping us on our toes, Lindsay. It is very important for us to understand that people are understandably worried. And that's why we want to be here to answer questions for you as well. I'm going to throw this one to you, Dr. Pebity. There have been some questions and some sort of discussion around, could this be because of all the public health and social measures, the fact that we were under lockdown in many countries, not a lot of social mixing? Is there any reason to think this could be somehow related to that period of time?
So no, it's a really good question. So I think of course we have to remember why public health and social measures were introduced, and of course that was because we were in the midst of the COVID pandemic, and at a stage where we didn't have vaccines, and where this was really our main intervention to protect the population, and it successfully did that for those countries that implemented public health and social measures. But of course, what it also did with that reduction in mixing is it also reduced a wide range of other common infections. So we know now that common respiratory infections like influenza, like RSV, but also adenovirus, the circulation of those reduced during that period. And now that we're getting back to more normal lives, we're seeing those infections increasing again. So, and indeed, we have seen an upsurge in adenovirus just recently, including in the UK, as we were discussing earlier. So, yeah, this is one of the threads of investigation that's underway. Is adenovirus linked potentially to these cases that we're seeing here? We don't understand fully whether it is, but very much an active line of investigation.
Dr. Easterbrook, if you can just explain what adenovirus is. So this is, as Dr. Pebity says, it's a line of investigation. It's one of the theories that's being pursued. We're not at a point now where we can say we think adenovirus is the cause, but can you just explain what an adenovirus is? Oh, you seem to be muted at the moment. No, can't hear you yet. Maybe now, try again. No, still not yet. Maybe we'll let you, and I know you dropped off and had to come on again. Maybe you need to do that again. I know our producer will try to follow up with you on that. So for the moment, I'll go back to you, Dr. Pebity. Can you explain what an adenovirus is?
Yeah, no, of course. So adenovirus is a group of viruses, very common, which causes commonly respiratory symptoms, can cause diarrhea as well. Very common in children, and it very unusually has been associated with hepatitis, but that's in children who are otherwise unwell, often with underlying immunosuppression. And so the picture that's been seen here, because a number of the children who have presented with hepatitis here, severe hepatitis, who have been diagnosed with adenovirus, these are children who previously have been fit and well. So this is sort of an unusual phenomena that we're seeing, and that's why we're sort of alerting parents and public health authorities about this.
So our followers, the people who are following this session, are amateur detectives and are wondering at a lot of different causes. Stephen Leon, I see that you were Googling and saw that we're looking up adenovirus. So now you have your answer from our specialists. Just to remind people that you can ask a question on Twitter using hashtag AskWHO, and on Facebook, LinkedIn, and YouTube, just put your question in the comment section. We're going to wrap up, I think, in a few minutes, because actually both Dr. Pebity and Dr. Easterbrook are actually in the thick of the response, and they have lots of meetings with counterparts and colleagues and so on to help move the information forward, share what we know, find out new pieces of data with advice as well to countries on what they should do. So there's one question from Amira Saleh, who's wondering whether these children had received a COVID vaccine, whether they either had COVID or had received the vaccine. So what do we know around that? And let's first test our technology. And if we're able to hear you, Dr. Easterbrook, we'll go to you. So let's give it a shot with you first. Oh, still muted. That's not muted, but we're still not able to hear your sound. I'm so sorry. I'm so sorry. So Richard, you're carrying all of our hopes and dreams right now.
No, that's fine. So yeah, as you say, there's a number of threads that are being followed. So on the vaccine question, I mean, that has been very and is being very actively looked at, and at this stage, I mean, there's no suggestion that vaccination is linked to this clinical presentation. That's COVID vaccination. The majority of the children haven't been vaccinated. They're not in the age group in most countries that's recommended for vaccination. So that's the first point. And then secondly, in terms of what role COVID-19 itself might be playing, it's not clear. I mean, some of the children have been diagnosed with SARS-CoV-2, but not all of them. Potentially it might be playing some sort of role, not clear, and really needs further investigation to understand whether it might be a factor in what's going on here.
I think that answers part of the questions from Sabina. Sabina Eklund had been asking, in fact, how many of the children had been vaccinated and so on. So if we are at we're in a situation where it's still unknown. Can you outline for us, Dr. Pebity, what exactly the next steps are? I know WHO has, for example, shared a questionnaire with countries and asking them to look out for certain things. So what's the next step? How do we, because at the end of this, this live session, people will come away not knowing the cause any better than when we started, right? We think we've eliminated some causes. We know we've eliminated the common causes of liver inflammation. Other ones, there's question marks around. So what are we doing as a scientific community with WHO in some ways at the center to advance our knowledge? What are the questions we have, and how will we start to answer them?
Yeah, no, really important points, and I think firstly, obviously, what we want to do is to get the message out about this incident, to raise awareness, so that parents, if their child is unlucky enough to have this syndrome, that they make sure it's taken to the healthcare system, and that the case can be managed and so on appropriately. So that's important from a kind of clinical perspective, to get optimal kind of case management. The other side, of course, to this is then to investigate the cause of the illness. And so once we've found these cases, we then need to initiate and undertake further in-depth case investigations. And those types of studies, and there's a whole range of them which are being discussed. Some of them are epidemiological, others
you're being called into your next meeting.
Yes, I'm sorry. And just
all right.
Let me put that one off.
That's all right.
So we need to basically get a good understanding of the cause through a series of investigations. Some countries are already initiating those, and that information can, as that comes further forwards, will help us to further refine the prevention and control measures to optimize the way these patients are being looked after. So all those threads need to be sort of occurring in parallel. So yeah, and it's obviously an effort that involves working across countries, across specialities. It's very much a multidisciplinary approach that's needed here, working between clinicians, public health authorities, risk communication. I mean, they all need to be very, very sort of actively engaged here, and of course on the lab side as well.
So WHO will continue to share, our technical colleagues will continue to share information amongst countries. As the communications team, we'll continue to make sure you hear from us as well. There's something called Disease Outbreak News that we've published 2 updates so far on this situation. We expect to continue to keep you informed that way. So just going to wrap up shortly. I want to let you know where people have been watching and listening to us from. Argentina, Malaysia, Sierra Leone, South Africa, DR Congo, the UK, India, Jordan, France, Poland, Kenya, Albania, Uganda, Cameroon, Sudan, Sri Lanka, Burundi, Turkey, Saudi Arabia, wave to Canada, Rwanda, Germany, Zambia, Switzerland, where I am at the moment, Colombia, Dominican Republic, Sweden, and many, many others. Sorry if I wasn't able to mention your name, but thank you for joining us. So to continue to get informed on this, follow WHO social media channels, follow our website, follow especially what you're seeing in your regional offices. So the social media platforms in the European region, for example, and in the Americas, to get the latest information. And of course, what you're hearing from our friends and colleagues in the media as well. Thank you for following this so closely. My name's Nika Alexandra. I work with the WHO communications team here at headquarters. We were joined today by Dr. Philippa Easterbrook, who's a senior scientist in the department that works on hepatitis here in WHO headquarters, and Dr. Richard Pebedy, who's a team lead in the WHO team in Europe that works on emergencies. So I will go to you just for a second, Philippa. I don't know if we've been able to get your audio. Can we hear from you? Otherwise, we might just need to wave goodbye. No, we never managed to solve that. I'm so sorry, but thank you for joining us. We can see you waving at least. And Richard, thank you so much as well. Thank you for being with us. Any last words for the public, for people watching today?
No, I just to thank everyone for joining and for their questions, and I hope it's been helpful, and thank you.
Thanks, and thank you both for the work you're doing as well. Good luck. Talk to you again soon. Bye, everyone.
Bye-bye.